Kidney failure is a life-altering diagnosis, but there are treatment options to help you survive. Renal replacement therapy is key. You may be familiar with hemodialysis, where an artificial kidney and a machine filter out waste from your blood. Another option is peritoneal dialysis or PD, which uses your body's peritoneum, the serous membrane that lines your abdominal cavity, to take some of the kidney's essential functions. How does PD work? To start, one needs a PD catheter, which is surgically placed, usually in the abdominal area. Ideally, the catheter placement should be where one can easily reach and see the catheter. Once the catheter is ready for use, you are prepared for PD. PD dialysis process. First, fill the peritoneum with a special fluid called dialysate. The dialysate will sit there or dwell for a couple of hours. Once the dwell time is over, the fluid is drained. This process is called an exchange. The fill and drain can be done through gravity or a machine. If it's through gravity, then it is the manual PD, also called continuous ambulatory peritoneal dialysis or CAPD. The patient may do exchanges several times a day. If a machine or cycler is used, it is called automated peritoneal dialysis or APD, typically done at night while the patient sleeps. It's as simple as setting it up and letting the machine do the work. You might be wondering, how does the peritoneum work? During dwell time, your peritoneum acts like a natural filter through diffusion, which allows the toxins to move from the blood into the peritoneal fluid. Fluid removal, also called ultrafiltration, is done through osmosis. The dialysate has sugar or dextrose, which will serve as the osmotic agent. Water molecules will then move from the blood to the dialysate. PD solutions are available in 3 dextrose strengths. The higher the solution, the more fluid it can remove. There's a PD solution called icodextrin that is non-dextrose based, and it can do ultrafiltration with an extended dwell time. PD solution also comes in different volumes. Larger volumes enhance filtration, but should be chosen based on size and comfort. Some patients may experience discomfort with a larger volume of solution. Getting started with PD. The good news is that PD is done at home. But before you can start, you will need training from a PD nurse, typically lasting 1 to 2 weeks. APD may take longer with additional training on how to use the cycler and troubleshoot machine-related issues. Each individual has a unique learning ability, so that training can be shorter or longer. The goal is for you to feel confident and independent to perform PD safely at home. How do we know if the PD treatment is working? The answer is KT over V, which measures how much waste your treatment is clearing. According to Medicare guidelines, a KT over V of 1.7 or higher every 4 months means your dialysis is adequate. What happens if a patient's KT over V is below 1.7? The doctor will adjust the prescription either by increasing the number of exchanges or dialysate volume. It could be dwell time or sometimes switching to icodextrin. Every person's peritoneum is unique, which is why some PD patients have different outcomes. There's a test called PET, or peritoneal equilibrium test, that helps determine the membrane's permeability. There are 4 types: high, high average, low average, and low. Knowing your membrane type helps doctors personalize your treatment for the best results. PD complications. One of the major complications associated with PD is peritonitis. Peritonitis is the inflammation of the peritoneum, often caused by bacteria or fungi. Symptoms may include abdominal pain, tenderness within the abdomen, nausea and vomiting, diarrhea, fever, and draining cloudy peritoneal fluid. Peritonitis is life-threatening and requires immediate treatment to avoid sepsis. PD patients are trained to recognize the signs and symptoms and know how to respond, often with intraperitoneal antibiotics until further medical care is received. Is PD right for you? PD is not suitable for everyone, especially if you have a history of multiple abdominal surgeries, obesity, no residual kidney function, and a low transport membrane. Researching and discussing with your doctor is crucial to determine if PD fits your health needs and lifestyle. If you found this video helpful, don't miss our next video about another home dialysis option, home hemodialysis. Thanks for watching and take care of your kidneys.